In a perfect world, your neck would look something like this when you walk or run. A nice, healthy shock absorber system bouncing and gliding smoothly with a nice, healthy forward arch. This is what we hope to improve in your neck. Keep in mind, anytime you have numbness, tingling going down your arms, most likely the nerve is getting compromised as it passes between and from between the bones in your neck and your shoulders and your upper spine. So it can cause problems in tightness of your muscles here, can cause muscle knots, cause irritation of the nerves going down into your arms. So we have to figure out the cause of that first and address that. So we talked about posture when you're sitting on your sofa. One time I was sitting at home on my sofa and just sitting watching the news. It was in the evening, and I started to nod off. And I wasn't thinking about the posture I was in. I had an overstuffed pillow pushing my head like this. I fell asleep, and when I woke up, I realized that my jaws were really tight. And I never get jaw tension. It was very unusual, and it occurred to me what was going on. So I thought, oh, this is weird. Then it occurred to me that I wasn't practicing what I preach. I was just spaced out, not thinking about things that I preach about. And I simply got rid of the overstuffed pillow that was pushing my head forward. I got something else, another pillow, and put it right in the middle of my neck. And within about 30 seconds, my jaws completely relaxed, my neck relaxed. And that's when it occurred to me that I need to be teaching this stuff to people, because if this stuff sneaks up on me, and I'm in the business, I'm doing it day in and day out for 25 years, then I'm sure it's happening to the people that I'm helping, especially when you kind of get into a relaxed state at home. I've observed that seems to be the pattern. Is often that people are having problems that are stemming from when they are relaxing at home. They're sitting on their sofa and they have an overstuffed pillow. So get the overstuffed pillow out of the equation and just put the pressure right in the middle of your neck. And we talked about computers. Pillows. Now you want to make sure that your pillows are keeping your head pretty level. And we're going to talk about why that's important. And the trick with pillows, and we're going to go ahead and stop the video for a minute, and we're going to actually put into this some information about pillow height. Okay, this is very, very important. Frankly, most people that come in for basic, everyday garden variety neck pain, headaches, pinched nerves, irritated nerves, degenerative osteoarthritis, muscle trigger points, muscle knots. You know, most of the muscle knots are a result of cumulative irritation that's been building over a long period of time. I'm going to show a few videos about the neck, and I'm going to talk to you about sleeping positions and pillow. Now, pillows are a big topic and a very important topic, and we're going to talk about how to properly support your neck when you're lying on your side and when you're lying on your back. Okay, when you're lying on your back, you want a pillow that has a little bit of an arch to it to support the forward arch in your neck. Remember, we talked about the forward arch. So if you're lying on your back, you want it to lift the middle of your neck. Notice that I'm not saying that you want your primary support to be on the back of your head. If it was primarily here, you're defeating your purpose. You want to make sure that it's primarily in the middle of your neck. Now, most people don't stay on their back all night. Most people will start to roll over from one side to the other, which is fine. The main idea is to keep your head level. So if you go to your side, I'm going to stack another pillow underneath this one. I prefer having a Tempur-Pedic style pillow stacked on top of a thin foam pillow. When you lie on your side, it allows the neck to end up pretty level if your shoulders are perpendicular to your bed. So if you're on your side, you want to put a small pillow between your knees because that takes the twist off your hips. But you don't want your pillow so thick that it goes uphill, and you don't want it so thin that it goes downhill. You want it to end up pretty level if possible, if you can remember that rule. So in review, the goal is to end up with a line between your neck and your spine. If the pillow's too thin, it's going to go downhill. That's not good. You want to maintain as much of a level line as possible. If the pillow's too thick or you have too many pillows, it goes uphill. That's not good either. The goal is to end up as level as you can. If you're face down, reverses the natural curve. That's not good either. Try to maintain a level pillow. This shows a gradual tearing that occurs between the spinous process of the bones in your neck. Typically from old injuries like whiplash injury, you get tears between any of the connective tissue attachment points, in this case the interspinous ligaments or muscles between the bones in the neck, which would set the stage for gradual adhesion, scar tissue, and dysfunction of the movement of the bones in the spine. Arthritis, stenosis, calcium deposits, and bone spurs gradually begin to set in over time. Also, if there's irritation for a long period of time at the spine, it can cause a sort of short circuit effect. If you'll watch this little diagram, you'll see how the little spark goes from the core of the spine where there's what's called a lesion. Irritation and dysfunction goes along the nerve root to the muscle, back and forth like a short circuit, causing muscle spasm and trigger points and muscle knots over the long haul. This shows a time-lapse photography, so to speak. If you look at that little red circle, you can see a gradual change from the nice thick cushion between the bones to a calcium deposit that gradually sets in more and more and more over 10, 15, 20 years. Gradually, arthritis, stenosis, which is a crowding of the nerve root, stiffness, pain, dysfunctional movement, bone spurs. All these things gradually set in when the spine is dysfunctional over time. So in review, this would be the ideal. This is what we want everybody to achieve: a nice, healthy, springy arch of the neck. Not a reversed arch, but a healthy, springy arch. We encourage you to learn more about the spine, how to take care of your spine. Go to our website, Chelsanna.com. This is Dr. Matthew Brown. I thank you for your time and I look forward to talking with you or meeting with you at your convenience.